This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for December 2nd, 2019. Well, happy holidays, everybody, from Atlanta and the Southern Health Lawyers. Hope you had a great Thanksgiving and are ramping up for the big holiday season. It's not cheery all around the nation, though, as Modern Healthcare reports last week that Sentara Hospitals, headquartered in the Mid-Atlantic region, has agreed with the Department of Health and Human Services, Office for Civil Rights, to pay a fine of just over $2 million for violations of the HIPAA privacy rule. And so as we head into the holiday season, we'll use Sentara as the ghost of Christmas future for those of you who have not gotten up to speed on your HIPAA compliance. So make sure that as you start to put together your compliance checklist for January of 2020, you include HIPAA privacy on your list. Here's why. The situation started with a very simple complaint that has probably happened to many of y'all who are healthcare providers out there in News Nugget land. A patient called the Office for Civil Rights saying that the patient had received a bill with another patient's name on it. The Office for Civil Rights initiated an investigation and found that just over 500 of these situations had occurred where patients were sent invoices from Sentara that included other patients' names on them. Now, in the world of HIPAA violations, over 500 is an important number because it triggers other obligations under the privacy rule, but on its own is not a horrific number because we've seen others that have numbered in the thousands. The kicker is, and the reason the OCR has assessed such a heavy penalty against Sentara, according to Modern Healthcare, is that there was a significant and systemic lack of business associate agreements throughout the system. Now, as a reminder, a business associate agreement is not required between every healthcare provider and every vendor. It's just for those vendors who require patient information or protected health information in order to be able to provide a service to or on behalf of a covered entity, like a healthcare provider, clearinghouse, or health plan. But without business associate agreements in place, that is a very important violation of the HIPAA privacy rule, and in the end is what got Sentara in trouble. So it starts with just one patient snafu on getting the wrong patient's information on a bill that basically is like a big ball of Christmas yarn. You start pulling and the whole thing falls apart. So unfortunately, bad news to wrap up the year for Sentara, but hopefully a cautionary tale for those of you who are covered entities under the HIPAA privacy rule. Put that on your compliance checklist for next year. Make sure you get those business associate agreements completed and signed. I'm Rich Sanders with Southern Health Lawyers. Thanks for your attention, and we'll look forward to seeing you again soon.